We're rolling. And we're talking about the choice between lung 5, which is a sedation point, and lung 9, which is a tonification point. And a deficient patient, they have really low pulses, they have a pale tongue, teeth marks, they talk in a low voice, they move very slowly, pale kind of face. Then we want to tonify with lung 9. Full of energy, loud talking, big pulse, red tongue patient has an excess problem, heat, then we'd consider lung 5 to sedate, to take out some of the excess chi and help it to flow. This is good for cough, asthma, coughing blood, sore throat, palpitation, pain in the chest, wrist, arm, because it resolves phlegm. It's another important one for resolving phlegm and promoting the circulation of blood, clearing the lungs, and also clears liver heat. Great abyss, Tai Yuan, is lung 9. Perpendicular puncturing, perpendicular, just 0.2 to 0.3 inch. Just barely in. So it doesn't flop over. Just enough to keep the needle in. That one, a lot of times you'll see it pulsing because it's near the artery. The needle will pulse. That's okay. Move, you know. Then we have lung 10, Yuji, fish border, on the radial aspect of the midpoint of the first metacarpal bone, on the junction of the red and white skin. I love this. White skin is on this side, red skin is on this side. There's no big difference between the color of the skin a lot of times, but you can see, oh, if this is the red side, this is the white side. On the junction, on the border, is the point lung 10. Really important point for sore throat. That's its main function. Works wonderfully for sore throat. That one and lung 11. We're just going to jump ahead a little bit. Lung 11 and large intestine 1. If you prick those and take out 3 drops of blood on each of them, on each side, sore throat, any sore throat will go away almost immediately. It's amazing. Because it takes out heat in a fast way. And we'll meet there, lung 11 on the radial side of the thumb, about 0.1 sun posterior to the corner of the nail. So like you go out a little bit from the corner of the nail. And that one, more often than needling, I'll use a lancet and take out a couple of drops of blood. Sore throats go away like magic. Stimulates the dispersing and descending of the lung qi, benefits the throat. Promotes resuscitation. We'll meet that also on the most distal points have this big effect on the head. The furthest away. Further away you go, the more specific it is for the beginning of the channel. It's really far out that way. So that's the lung meridian. And then they talk about the Ting well, the Ying spring, the Yuan source, or the Shu stream, and then the He. Like how the meridian is supposedly flowing in that direction, but from the proximal, or from the distal to the proximal, there's an increase in the depth of the qi, the substantiality of the qi of the points, and they're compared to the beginning flow of a body of river, a body of water, the well, and the trickle, and the stream, like a river, and then the ocean is up at the joints and the elbows and the knees.
Would that be like how you were saying the candle and the
Right.
campfire? So
Yeah.
depending on the severity of the what?
Yeah. That's right.
Question.
Okay.
So you were saying about I don't remember which it was, but using the right arm, the right hand to clear things in the left foot.
Uh-huh.
Would that have anything to do on the lung meridian? Would you?
Absolutely. Yeah. Yep. And we might as well, because this is, I don't know if it's going to be on the test nowadays, but based on the clock, the circadian clock that we saw,
Mm-hmm.
and the different relationships between the meridians, hand tai yin to foot tai yin, like how they're related.
Oh yeah.
We can see how if there's a pain along the lung meridian, you can treat it. You say that, now it's not an organ problem. We're going just off the meridian system. This is Dr. Tian's balance method. Completely extra credit here. But so important in clinic. I use it all the time in clinic. And it's gaining much more traction nowadays. If there's a problem along the lung meridian, you can needle the spleen, bladder, large intestine, or liver meridians, or lung meridian on the other side, and affect the flow on the lung meridian. So, if there's wrist pain right there, at the bottom of the thinner eminence, you'd say, oh my gosh, that really looks like, they're pinpointing, they say the pain is right there. That looks like lung 9 to me. So you go down to the spleen meridian on the contralateral side, and it's right around, that's would be the angle. So we would choose like spleen 4 or thereabouts. We palpate. Which is the most, it's a little tender. It's not really exactly spleen 4. It's a little bit up towards, or spleen 5, excuse me. It's a little bit towards liver 4. More tender there. And you needle it there, and then immediately they're like, okay, yeah, I can move that, and it doesn't hurt now. Good, done. Let them sit for 45 minutes and move the previously painful area a few times during that session.
With the needle in it? Or,
With the
that's
needle
right.
there.
Mm-hmm.
So they can move this. That's why we needle contralaterally. They can move the qi through the stuck area. and you ask for $60. And they're like, sure. So that's just, okay, we were talking about the 3 T's, and it's actually 4 T's. What we're learning here is TCM, traditional Chinese medicine. That's the first T. Then Turk's method, which is the deep needling method. Then Tan's method, which is the contralateral method. Then Tong's method, which is its own thing.
Was that the, like you said, the 4 horses or something?
Yes.
Okay.
4 horses is a Master Dong's point.
Cool. Awesome.
So the 4 T's of Chinese medicine covers acupuncture. It covers how I do acupuncture. How I try to get optimal. I use the best treatment strategy for the problem. Sometimes they'll come in and, I'm going to treat this best by doing the TCM diagnosis and needling TCM points to make a cure that way. If it's a pain problem, just a short-term sprain, then Tan's method. If it's long-term chronic pain and we've been using Tan's method up to a certain point, it's not progressing, then we use Turk's method. Master Dong's works all the time in different ways. It's the wonderful mystery. Meaning that there were many different Chinese medicines. There are many different lineages of Chinese medicine active in different parts of China over the thousands of years of practice. When the type of medicine, TCM, that we have came from communist China when they tried to codify it. They turned it into one whole package and also remove any reference to spirit or energy. They tried to make it a science. So we have this benefit. They made it very scientific and palatable. It goes across borders when it's disguised as, communist version of traditional Chinese medicine. But in doing that, they had to ignore or discount a lot of other lineages, a lot of other practices that were alive within family lines. And, unfortunately, perhaps were disrupted. Like Master Dong was able to continue teaching and practicing because he was in Taiwan. A lot of my doctors I studied with left the chaos of the Cultural Revolution to continue practicing traditional medicine. For a while, it was like part of the old antiquated culture that China wanted to completely be done with. They went nuts and threw the baby out with the bathwater in so many cases. Party line Chinese, communist Chinese wouldn't say so. It was the great progress that China was taking a step into the 20th century. But it was really the kind of social chaos. That Chinese medicine, as we know it, how it came to us, came out of. So we're in this whole thing of reinvesting, reconnecting the spirit of the medicine, discovering the spirit of the point and the let's say, energetic or transformative qualities, evolutionary qualities, spiritual evolutionary qualities of the medicine, and bringing that back into it. It was always part of it. The Taoists living in harmony with nature and with their life and with their community. That would make happiness. That would make health. For living in accord. So we want to take it out of its context and see everything, oh, this one specific point does this because it's connected with this, and so it makes sense. And there is a bit of that, there's a good bit of that. But then there's this larger scope. We always want to go in deep, 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 and then back it out and be able to put it into the holistic sense. Thank you for joining us. This was about the lung meridian. And it's I think it's did that do it? Or the button in the film?
Yeah, I think that. Oh no. The button. That's right.